Hello, my name is Bridget Rodriguez, and I will be discussing why a bachelor's degree should be the minimum level of education for entry-level nursing. Nursing has always existed, and in the beginning was done by monks, nuns, and regular women within the confines of their homes. Nursing was thought to be an unskilled occupation, a job in which a person performs a task that does not require specialized skills, and is meant to only take care of patients physically. A profession has the characteristics of being an altruistic, has a specialized body of knowledge with an extended amount of schooling and autonomous work that has distinct ethical principles. This means that for nurses to be considered professionals, they need a standardized form of schooling. The education system was challenged by the Brown Report in 1948, stating that nurse schooling should be moved to colleges and universities. For nursing to be acknowledged as a profession, for the length of schooling matters because the perception of a profession is one that takes an extended amount of time. This sets the precedent for why the minimum schooling for a nurse should be a bachelor's degree. This paper will discuss the why a bachelor's degree should be the minimum education level for entry into nursing and how it greatly benefits the profession itself. How education impacts nursing professionalism and image of the profession. A bachelor's degree should be the minimum to advance the future of nursing. The nursing image is affected by the variation of nursing programs available today. When the standard of and quality of education varies from licensed practical nurse, associate's degrees, and bachelor's in nursing, the quality of education is not standardized. Professional preparation is a necessity when a job moves from an occupation to a profession because specialization is needed. A bachelor's degree as a minimum educational standard will allow for the image of nursing to be taken as a serious medical profession because nurses will be seen as knowledgeable and adept at their jobs. This also allows a nurse's position to be defined as important and prominent in the healthcare system. In American society, people view nurses as physician dependent. For this perception to change, nurses must be seen as adept, autonomous professionals. This means going to school for a standardized amount of time to gain their specialized education. Nursing is a healthcare field that is constantly expanding, and the body of knowledge a nurse needs to know to be skilled is growing. This poses a dilemma because the standard of education for professional nurse is not met by programs that are less than a bachelor's degree. Professional preparation in a university or college also helps prepare a nurse by learning values, beliefs, and attitudes for being a nurse. Schooling helps a nurse gain the knowledge and skills they need to be considered adept professionals for an evidence-based practice such as nursing. Nurses that have a BSN, according to a study done by interviewing hospital directors, 72% of directors said BSN nurses were better prepared because they have a better application of knowledge. Bachelor's degree nurses, prepared nurses give higher quality patient care. Nurses having bachelor's degrees as a minimum education requirement does not only help them, but it also positively affects patients. Positive patient prognosis is higher with a nurse with that is BSN prepared. This means when a nurse is BSN prepared, they can care better for a patient because they can think quickly and efficiently and apply the knowledge that they learned in school and at the job. This leads to less patient deaths because of preventable factors. A study done on patients in Pennsylvania and New Jersey saw that 13.9% less deaths occurred in New Jersey and 10.6% less deaths occurred in Pennsylvania after being cared for by nurses with bachelor's degrees. This trend appears in many studies done by researchers. Another study was done in 21 university hospitals, and they saw that in hospitals with higher percentage of nurses with bachelor degrees, there was less congestive heart failure, or deaths from congestive heart failure, decubitus ulcers, failure to rescue, and care for patients for post-operative deep vein thrombosis or embolism was done in a shorter amount of time. Education is a responsibility for nurses in the position of the American Nurses Association. Nursing is an evidence-based practice, which means a nurse must dedicate their life to learning new materials because the profession is based in current research. Nurses have a responsibility to further educate themselves and strive for higher education to advance the nursing field as well. This means that a nurse has a responsibility to the future of nursing as an individual, to further their education, to promote professionalism in nursing. A nurse must start to see themselves as a scholar and must learn new information and understand that acquiring the fastest degree may be important at the moment, but advancing the degree is vital to the nursing field. Many hospitals require a bachelor's degree to have higher positions within the hospital. If more nurses were educated with bachelor's degrees, they would not have to hire externally or hire non-nurses to fill administrative positions. The American Nurses Association also agrees that most nurses should have their bachelor's degree, and that it should be moved. It should have been 80% of nurses having their bachelor's degree by 2020, but the amount of nurses that have their bachelor's degree at this time it's only 57%. The American Nurses Association first published a paper on this, saying in 1965, concluding that bachelor's degree should be the standard of education for nurses. The pros and cons of a bachelor's degree in nursing. The disadvantages of getting a bachelor's degree as the minimum for credentialing is that it is expensive and could be a financial strain on many people. It also takes a longer time to acquire and might not be the best way for someone to get into the field if they're short on time. Also, nurses that already have an LPN or an associate's degree may not have the time or the money to further their education because they have families and also their own expenses that they have in their life. The advantages of a BSN in nursing is that usually bachelor prepared nurses make more money than associate degree prepared nurses. This is an incentive to further their education. BSN educated nurses also have better chances of patient survival and recovery. Many hospitals require a bachelor's degree to have a higher position within the hospital. This will help empower nurses personally as well because they will be able to climb the ladder professionally. If more nurses or all nurses were educated with as previously stated, with a bachelor's degree, they wouldn't be able to fill administrative positions and gain more power within the workforce. A bachelor's degree in nursing is vital for the advancement of nurses all over the world and the country. This sets a precedent for higher education and acknowledges nurses as a well-trained healthcare professional. Moreover, a bachelor's also sets the standard of higher patient care, which is a primary responsibility of a nurse. Nurses are obliged ethically to strive to further their education. This is because, as a nurse, knowing that the mortality rate of patients lowers by acquiring or being treated by a nurse with a bachelor's degree, it ethically binds you to having to do that. So an ethical principle that goes with this is non-maleficence. It's one of the core nursing ethical principles, which means to avoid harming or hurting a patient. Therefore, it would be required for them to have to achieve the standard of schooling to reduce harm to their patients statistically. Another ethical principle is beneficence, and it is a principle that is backed by the advocacy for our patients. Nurses are the main advocates for their patients and therefore need to acquire further schooling to better their patients' experience in the medical facilities. I personally agree that nurses should acquire a bachelor's degree just so we can have more power within the field and be viewed as professional and not dependent on, doctors. I also think that to better patient care within the field, we should get a bachelor's degree because we would know more. We would have more logical thinking skills and all of that. But I don't believe that an associate's degree should be completely done away with, or an LPN. I think that the bridging programs should just be facilitated to attend by hospitals or wherever a nurse practices.